What is the Centers for Medicare and Medicaid Services WISeR model? Breaking news for those interested in healthcare. A new initiative is gaining attention. The Centers for Medicare and Medicaid Services has introduced the WISeR model. This program aims to tackle wasteful spending in Medicare, a topic that is on many people's minds today. If you are curious about how this model could impact healthcare costs and services, you are in the right spot. The WISeR model, which stands for the Wasteful and Inefficient Services Reduction Model, was announced by the Centers for Medicare and Medicaid Services Innovation Center. It is set to run from 2026 through 2031. The goal is to control unnecessary or low-value care, which costs taxpayers billions of dollars each year. Under this model, the Centers for Medicare and Medicaid Services will partner with third-party technology vendors. These vendors will utilize artificial intelligence, machine learning, and automated decision logic to review claims. This review process will focus on services that are often overused or improperly billed. These technology vendors, known as model participants, will be compensated based on the savings they generate by avoiding payments for unnecessary services. While participation in the model is voluntary for these vendors, all Medicare-enrolled providers and suppliers in selected states will need to comply with the model's prior authorization requirements. Providers can choose to opt out of prior authorization but will face prepayment medical review for claims that do not have prior approval. They can resubmit prior authorization requests multiple times after a denial and request peer-to-peer clinical reviews to discuss alternatives. If claims are denied after these steps, they will go through the standard Medicare appeals process. One key feature of the WISeR model is that providers or suppliers can be exempt from prior authorization if they maintain a provisional affirmation rate of 90% or higher during a performance review period. This model represents a significant expansion of prior authorization in traditional Medicare. The use of artificial intelligence-driven tools, combined with clinician oversight, aims to assess medical necessity and reduce wasteful spending. However, there are concerns about the potential overuse of artificial intelligence in coverage decisions. Some worry that the incentives for contracted companies may lead to more claim denials in order to generate savings. In summary, the WISeR model is an effort by the Centers for Medicare and Medicaid Services to use technology to improve the management of prior authorizations in Medicare. The aim is to cut down on unnecessary services and associated costs while ensuring clinical review by healthcare professionals.